welcome to The Extra Mile. I'm Linda Boudreau. Our guest today is Scott Hollier. Scott is a physical therapist here in Acadiana with offices in Maurice and Abbeville. He's also one of my favorite guests because, Scott, every time you come, I learn something new. Our audience learns something new, and we feel a little bit better. So welcome back. It's good to see you.
Thank you very much. I appreciate being invited, and glad to share what I know with you and the viewers of Acadiana.
And it's really about well-being. Physical therapy is about feeling good and personal well-being. Is that fair to say?
That's well said. And so what we're going to talk about today is along those lines. And for anyone who knows me, I love talking about the occupation that I participate in every day, and I also am going to talk about some recreational activities that I have a great affection for.
I wonder what that could be. Bated breath, folks, bated breath.
So, what we're going to talk about initially is posture, and it's going to be our posture in standing. And posture and standing is a relationship that we have on our 2 feet with respect to the floor. All right.
But see, we think we all know how to stand because we all do it all the time, right?
That's the typical assessment, and there's some truth to it. However, like anything else that we do, there's an efficient way of doing it, there's an optimal way of doing it, and there's a poor way of doing it.
Okay, that poor way gives you backache and all that kind of stuff.
It gives you foot pain, knee pain, hip pain, back pain, all kinds of pains.
Yeah.
What a lot of people don't realize out there is that the floor is a very bad teacher.
Why?
It's a bad teacher because it's usually concreted, number one. Number two, we wear shoes. And so our relationship with the earth has some barriers to it.
So you're saying that standing is really about a relationship with the earth?
That's true. When you stand on 2 feet, you have what is called ground reaction forces. And so if you stand on your 2 feet and you stand erect, the forces of body weight are going straight into the earth. However, if you reorganize yourself in such a way that your feet push out, you can recruit shear forces of the ground. And they are a good way for us to rotate in space. So what I'm going to do is I'm going to stand up and talk about how we stand in relationship. And for most people out there that stand, they stand with one knee straight and
one hip out.
One hip out,
right.
And so you have this big asymmetry, which of course causes knee pain and back pain. Because so when you straighten out one knee, it takes your trunk and it makes you move forward. So if you're doing a lot of ironing, or if you're working in a standing position, if you're a homemaker and you're cooking or washing clothes or doing dishes, you're interested in doing it quickly and fast. But if you have to do it for a prolonged period of time, you tend to lose that optimal relationship with the ground. So I've decided that what I wanted to show Acadiana was that if you can take an object, towel, pillow, oh, there you go, something that we normally see on your couch, yeah. You can utilize that in such a way as to recruit the ground reaction forces. So what I'm going to do right now is I'm going to take this ball and I'm going to put it between my legs in such a fashion. So what the viewer gets to see is that I am holding a ball between my legs and I'm pressing inward. And that pressing inward causes my feet and toes to be talonized and grip the ground. And it also affords my foot to push out and recruit the ground reaction forces called shear forces. And so all of a sudden I'm now much more stable. And one of the byproducts of stability is it allows me to recruit my core, my trunk musculature, the powerhouse of our upper body. And so this enhanced posture allows me to stand longer without pain, takes the stress and strains off my back, and tends to load the musculature in my glutes, my thigh muscles. And so if I stand like this for an extended period of time, I can stand longer.
And not get tired as quickly. Is that
And not get tired as quickly. That's a good point, because people alter their countenance and their postures directly related to their fatigue. So I have a ball here so that the viewer could see what I'm trying to teach. But what I'm trying to teach is a kinesthetic sensation. It's a muscle memory. It's a bodily awareness and a bodily sensation. So what I'm going to have Linda do is she's going to take the pillow that normally we all have on our couch or love seat or recliner, and I'm going to have her stand up. And I'm going to have her put it in between her knees. So you stand there. There you go.
Okay.
All right.
So
and so what the viewer gets to see is that she is standing in such a way and using a training aid to improve her standing posture.
But what I'm trying to do is learn how this feels, right?
That's correct. That's right. So she's squeezing her knees together, and by doing so, she's improving her stability. And I'm going to show the viewer out there because I'm going to push on her. So as I push on her, she has to react in such a way that I can push harder and harder and harder, and her body will recruit the ground. And recruiting the ground allows her to be stronger. So I'm pushing in the frontal plane of motion. Now I'm going to push in the sagittal plane. And then I'm going to twist her, and then tell her, don't let me twist her, don't let me twist her. And so what she does is she recruits her leg musculature, her hip and pelvic musculature, and she gets stronger and stronger. So that if she has to stand for any length of time in her home doing a task, then she can do it easier, more efficient, and with less energy wasted.
Okay, and it feels better. You know, it really is. Once you get used to this, it's more comfortable.
That's true. Good. You demonstrated that very well.
Thank you so much.
Okay, now since I have a great passion for one of the great sports in life called golf, I wanted to show the Acadiana viewer out there that if they wanted to improve their ability to strike the ball optimally, and by that I mean we're trying to get the club head to move at a real fast rate of speed, and to end up in balance, you can take this ball, you can take a cushion, or you can take a towel, and you put it between your calf muscles or around your knee, and you take the club, and you're going to hit it into a bag, an impact bag. And so if the weather is bad outside and you can't play and you're dying to play, but you can't because the conditions are not, wouldn't allow you to go out and play, you can practice this little technique inside your residence or your office. And so I'll just take the club back a little bit, and then I'll swing into the bag. And what you get to see me do is you get to see me do it in such a way that I'm not moving a great deal. And the less motion you have in the golf swing, the more inclined you are to hit the ball on the center of the club face. And so golf is a rotary motion, and training with the ball between your knees and calf allows you to rotate and not sway off the ball, and so that you can practice over and over and over this repetitial motion of taking the club back halfway, stopping, and then swinging down from the top. The more you practice this, the more likely you get to feel the recruitment of the ground reaction forces that I teach. Now, if you don't have access to a golf club, or and specifically an impact bag, you can take a towel, roll it up, put some tape on it, and practice the same maneuver into whichever object you want to practice hitting it into. And this teaches you stability, it teaches you release of the club head, because what you're trying to do is you're trying to increase the speed of the club head, and the faster you can do that, the further the ball will go. So just as a nice little exercise to prevent boredom, to enhance your golf swing, you can just practice this over and over and over like I do. And doing so allows me to recruit the ground to swing with the most efficiency and the best posture so that the ball will go nice and far. And that's important to every golfer I've ever met in
So
my
how
life.
good a golfer are you anyway, Scott?
I'm a competent golfer.
All right, that's a good thing.
I came to golf late in life, and I've, it has taken me all over the world.
Really?
Mhm,
So you're serious about that?
I am, and I like competing, and I know in Lafayette we have the Senior Louisiana Amateur Golf Tour that Commissioner Eric Simmons has put together, and so for those out there that like to compete, it's a nice little venue, and all the golfers I know are crazy about the sport and will do anything to get better. So I try and share this with them.
Let me ask you this. The moves that you're making to be a good golfer, do they help you in any other sport or any other aspect? I mean, is it good for overall health, or is it just good for a good golf swing?
Well, it's first and foremost, it's good body mechanics.
Okay.
So good body mechanics is just organizing yourself in such a way that you can do more with less. So if I go from sitting to standing, I can do it in a very inefficient way. So people with backache tend to move like this. They tend to sit back in the chair too far. Right? When they get to go up, when they want to come out of the chair, they have to throw their head forward, and they have to stoop over, and then finally work themselves into a standing posture.
That's from a bad back.
That's for a bad back, and that will give you a bad back.
Okay.
There's a more efficient way of moving, and so I'm going to teach you.
Okay.
And so if I go from sitting to standing and I go straight up, then I have less problems. So I have a wide base of support, I stand tall, I look up, and I go up.
Okay.
All right?
Okay.
So what I'd like you to do is sit on the edge of your chair,
Okay.
just like the viewer out there who can
And you can do this
you
with
can
me,
do this too.
TV land.
And so you sit at the edge of the chair, you get a wide base of support, you tend to look up, not down, and then you stand up. There you go.
Okay.
Good. And so what the viewer just saw Linda do is she organized herself in such a way that there was this nice, smooth transition from sitting to standing. All right?
But you know, I was saying this earlier when we were talking about this, females are not taught to have a wide stance. You know, we're taught keep your knees together, you know, sit like a lady, and that is a different way to stand.
Yeah, that's a good point. What I've come to experience and see is that society's mores and culture tends to override a lot of good science.
Okay.
So, nevertheless, with or without a dress, with or without pants, the wider your base of support, the more you get to recruit your core, you get to recruit the glutes, the more you can go from sitting to standing with less effort, more efficiency, less energy expenditure, and you can use this to teach body mechanics, but you can just repeat it over and over and over, and you will enhance the person's ability to recruit their body's musculature and take the stresses and strains off of the back and the lumbar spine.
Is that really where we're most vulnerable? Is the back and the lumbar spine?
In Western society, where we no longer squat to do anything, it is a big problem. We spend most of our time sitting.
As we're doing right now.
I'm sitting. Then the chair tends to be the enemy. As I get older, it's the enemy. If I'm injured, if I'm hurting, if I'm elderly, that area, because of the chair makes us slouch like this, and we compress the spine. When you sit correctly, your spine is unloaded and your core is loaded. So when
I just felt it.
there you go, that's
yeah.
good. So to feel it, you have to feel your stomach muscles tighten. All right?
But it shifted the where things were.
That's correct. And the shift goes from the bones of the spine to these firm musculature of your core muscles. And so you have to be able to feel that. Now, very few people out there are going to go do sit-ups, but you can sit in a chair in such a way, put your hands on your stomach, and if you lean back and come forward and lean back and come forward, you will feel your stomach muscles engage when you come back, when you go back and when you come forward.
Yeah, that's a very easy, low stress little baby sit-up.
That's true. And when you lean back, you're going against gravity, and going against gravity trips the core musculature to contract. You can continue doing that, and you can make a noise with it. You can put your hand on your stomach and grunt. So you can go,
And what is the grunting going to do for me? Just keep me entertained?
The grunting will make you laugh.
It
will make family members pick on you. All right? But what it does is it's just the use of the breath to recruit your core musculature. Right?
And when you're doing this, stay straight, I guess. Don't do it like this, huh?
That's correct, yeah.
Okay.
Oh, yeah. You have to sit tall. Sitting tall is an optimal way of sitting. It engages the muscular and the powerhouse that we intend to.
But you know, Scott, that's like work to sit like that. You know, I mean, we're so used to sitting like this.
Yes.
That this takes conscious effort, and then it starts to be uncomfortable.
Can we learn to
be comfortable after a while doing this?
Yes. That's a good point that you make. This is a physical approach. When you go see a physician about some ache or pain, you're going to have three choices, and they are pills, needles, and knives. Pills, needles, and knives.
Yeah.
Now, this is a physical approach, so it requires physical effort. So going from sitting to standing requires physical effort. Right? Twisting requires effort. Right? But arm raises require effort. Balancing requires physical effort. All of these physical manifestations of what we call physical medicine have to be repeated over and over to make them an unconscious response. All right? Okay. So for the viewer out there who's ready to work, who's tired of their aches and pains, I promise you, if you do arm raises as high as you can, trunk twist, leg lifts, sitting to standing, and balancing on one leg, you will get to experience a nice balance and a respite from your aches and pains.
Really?
Yeah, I teach this every day to my patients in Acadiana. I share this with various colleagues. I speak at various media centers about physical therapy and what we can do to help you. And we have a good success rate.
But we have to do it.
But you have to do it. That's it. You have to buy into it. The viewer has to want to do it. And you know, as we all age and society is aging, what we find is that you can go into old age with less aches and pains, illness and disease if you are fit, if you're balanced, if you're conditioned, if you're knowledgeable, and if you have a little get up and go. All right? Okay. Because in Acadiana, some of the population is too big. Yeah. And so the bigger you are, the more difficulty you will have. So eating correctly, eating heart healthy, following the doctor's advice, getting together with a knowledgeable healthcare provider who has your best interests at heart, you can go into old age in a very enjoyable state.
So that's something that we can look forward to rather than look at with dread and apprehension.
Absolutely. You know? The two large influences of my life are my 92-year-old father and my 85-year-old mother. And they're aging like I want to age. They keep their body weight within normal parameters. They are active every day. They read quite a bit, and they share their experiences and hopes with us, and that will be transferred and transposed on down to my children and grandchildren. So that's the way to go.
It is indeed. And a lot of this is within our own power. Now, physical therapy plays a fairly significant role in the whole spectrum or continuum of care, right?
More and more so, as scientific research is showing. There are optimal ways to do things. And in my world, it has to do with functional movement. And so I'm trained to do functional movement screens. I can help the viewer out there. move in such a way that they can move more efficiently and with more confidence. And the science backs us up that we really can help people out there.
So back to kind of ground awareness. Let's say I was looking at my 2-year-old granddaughter the other day, and her posture is beautiful. You know, it looks like little kids stand up really straight. Am I right about that for the most part? No?
Yes. I've noticed that too about my own grandchildren.
So what happens between, say, 2 and 20?
There you go.
All of a sudden, we're just like not doing it anymore.
That's a good question. My take on it is we are born with wonderful body mechanics.
I think so.
We are born to play and to move and to explore.
To climb and jump.
That's true. But beginning at the first grade, we were introduced to the table and the chair. The table and chair and the school combined to teach us the 26 letters of the alphabet. The 26 reading and writing, learning the 26 letters of the alphabet, requires us to be stationary and our hand and eye to move.
Okay, I see that.
So once that starts, because reading and writing is not, you're not born with that. You have to be taught that.
Right.
And so to be taught that, we start on this journey of the next 12 years of our life, sitting for 8 hours a day in the school setting. And so that environment produces the eye to become the dominant sense, as opposed to our bodily sensations and kinesthetic awareness.
Okay, I see that.
So that's the answer to your question. The kids today and the adults today that transition that the best are the ones that continue moving, continue staying fit, continue making physical movements an optimal part of their life.
So we should definitely be having PE in schools and having kids active. And I'm thinking that because when you're talking about like ground awareness, or what was the phrase you used?
Yes, ground reaction forces.
Yeah, I don't even know what that is.
That's right.
Yeah,
Most
I don't
people
know how
did.
it feels.
Most people didn't. Until I became a physical therapist, I didn't know what ground reaction forces were either. But these are just terms that describe the push and pull that we do to propel ourselves forward in walking, in crawling, in swimming. And so we don't live in space. We have to push off. So when you go from sitting to standing, you push off on the earth. When you go from a squatted position to running, you push off, all right? And so the physicists and the biomechanical engineers have come up with terms to describe how we push and pull against the earth. And so very few people understand ground reaction forces, but the very good golfer understands ground reaction forces. The person who can stand and have no pain understands ground reaction forces. And if they don't understand it academically and clinically like I do, they understand it intuitively because they stand without any problems. They stand and they don't have any backache. They stand and they don't get tired. So
if we're standing and getting tired, if we're standing and getting backaches, if we're standing and our hip is going out, then we know that we're standing incorrectly. That's what that message says us.
That is correct. That's correct.
Yeah.
And we are going to make accommodations. We are going to stand in such a way that will create imbalances, tightness, and lots of our pains come from imbalances and tightness.
And that becomes body learned too. I mean, the body learns incorrect as well as it learns correct.
Absolutely, absolutely. So if you come by my place, and I would do a functional movement screen on you, checking your posture, checking how you go from sitting to standing, checking your gait, checking how you swing the golf club. All of those things can be done in such a way that they cause no problems whatsoever.
Okay. So part of it is becoming aware. If we're making mistakes and not feeling good, we can do something about it. It can be corrected.
Absolutely.
And we just have to do the work.
Absolutely.
And the body's going to learn good stuff or bad stuff because the body's just going to keep going.
Correct. That's correct. Yeah, because we don't live in a vacuum. We live in relationship to gravity. So how we utilize gravity and the Earth's forces can make us feel better or make us feel worse.
So it's all up to us. Scott, thank you. I'm glad you're a good golfer.
Yeah, thank you. Thank you for inviting me. Thank you for Acadiana for listening.
Thank you. Thank you. If you have a backache, call Scott or put a ball between your knees and stand up straight. Thank you so much for being here today, Scott. And thank you for watching The Extra Mile.